Hi, my name is William. I'm a blood cancer patient. This channel is all about my experience as one of the first people to be treated with a combination of two different drugs, Ibrutinib and Venetoclax, as a first-line treatment for CLL/SLL. Can I say right at the beginning, I'm not a doctor. I'm not a medical professional. This channel is all about my experience as a patient. This channel is dedicated to my spouse, who's been hugely helpful during my journey with CLL, to my fellow CLL patients, to the families of those patients, to the doctors, the nurses, the hospital assistants, the clinical staff, the admin assistants at the various different hospitals who treat people with CLL, to the very brave patients with CLL who are involved in trials for new drugs for CLL, and to the medical professionals and students who are thinking about devoting their careers to finding a cure for CLL. CLL is a journey, not a destination. I express my sincere thanks and huge gratitude to John Gribben and to the team at the London Clinic, who were absolutely fantastic in helping me on the nation. Hello and welcome to my video on Venetoclax. Venetoclax is a wondrous drug. I was on it for 12 months, so a fixed term therapy. What is Venetoclax? Venetoclax is a targeted anti-cancer therapy. And in effect, what it does for blood cancer is it attacks the tumor cells. It's a very powerful drug, and you take it in 4 by 100 milliliter pills. Take it at the same time of the day, and I took it with food. Now, because Venetoclax is so powerful, you have to have what they call a roll-up. So you can't just start with the 400 mils. There's a danger that you might get something called tumor lysis syndrome. Now, my understanding of tumor lysis syndrome, and remember, I'm not a doctor, is tumor lysis syndrome happens when the anti-cancer meds create so many toxins in the blood, and the tumors themselves are coming out of the blood, and there's just too much stuff going on for your body to deal with it in the normal kind of way. That's bad news, and therefore the protocol has been set up. It works very well, even if it is a little tiring, and I'll run through the dates just in a minute. But it allows you to build up the dosage of Venetoclax up until you can get to the 400 mils. So what happened for me was on a Monday, at the beginning of January, I went to the hospital and I took one pill, which was a 20 milligram dose of Venetoclax. I then sat in the hospital and waited for 6 hours. And then at the end of that 6-hour period, they took a blood test. And then I waited for 2 hours for the results of the blood test to come through. They're looking for a specific kind of protein which is indicative of the presence of tumor lysis syndrome. Happily for me, there was no issue or problem. I then carried on with the 20 mils for the rest of the week. And on the Friday, I went back to the hospital for another blood test in preparation for the following Monday. So you do Monday and Friday. This is how it worked for me. And we started with 20 mils. The following week, it was exactly the same, except the dosage this time was 50 mils. The week after that, the dosage was 100 mils. The week after that, the dosage was 200 mils. And finally, after 5 weeks, you get to the situation where you walk out of the hospital with a huge box of Venetoclax tablets for the 400 mil dosage. Now look, on those Venetoclax box, it says cytotoxic drugs. Now many people consider cytotoxic drugs to be chemotherapy, and that's what I think it felt like to me. But it's a targeted therapy which attacks the cancer cell. Once you're on the Venetoclax, you take it every morning. I took it with breakfast. I didn't try taking it on an empty stomach. It worked better for me to take it with breakfast. And I had a decent sized breakfast every day with the Venetoclax. And I could live a normal life. And I think that's my key point that I want to make on this video with Venetoclax. You could go to work. I did. I could travel. When traveling, I made sure to keep the Venetoclax always in hand luggage. Never, never check it. Certainly that is my advice in terms of that particular scenario. Like all of these drugs, there are certain things you cannot eat if you're on Venetoclax. And for me, that was Seville oranges, grapefruit, all grapefruit products, and also star fruit. So I had to keep away from those. If you like a tipple, I've got some bad news for you. Venetoclax and alcohol, certainly, even in moderation, did not work for me at all. And that's something that I tried it once and it did not work. I had a 4-day hangover. I wouldn't recommend it to anybody in terms of that perspective. But you might be different. The final point about Venetoclax that I want to make is it'll say on the package, and your doctor will probably tell you, drink some water with Venetoclax. So the recommended dose, according to my package, was 1.5 to 2 liters a day. I soon worked out that actually I needed to drink a lot more water than that for me. Typically, I would only start to feel really well on the Venetoclax when I had 3 liters of water. Some days I did drink 4 liters of water. And how I would do that was to have a bottle of water in the fridge, chilled water, was certainly better than room temperature for me. So I knew how much I was drinking during the course of the day. And if I found that I wasn't drinking enough water, I would soon start to feel pretty unwell. Flu-like symptoms, really. But it would go as soon as it came, and it would be gone when you have the opportunity to drink plenty of water. So 1 bottle of water, 1.5 liters, 2 liters, whatever it is, put tap water in it, stick it in the fridge, make sure it's nice and cool, and sip from it during the course of the day. Seemed to work extremely well. Side effects on Venetoclax. I'm going to talk more about these in the next video, but there's one thing I do want to talk about in this video, which is that Venetoclax has a known side effect where it increases the amount of uric acid in your blood. Now, I had this problem anyway, in terms of my own physiology. So I knew going into my treatment that this could be a challenge for me. No problem, the doctor said. Here's a drug which is a reducer, in my words, for uric acid, and it's called allopurinol. So I took some allopurinol for the first couple of weeks back in that run through that I was talking about, and unfortunately for me, I developed a rash. The hospital were all over it, and they switched the allopurinol to another drug which was called febuxostat. Again, just 1 pill a day. So what I would tend to do is I would take 1 pill of my febuxostat to start with. I then take the 4 Venetoclax. I then take the Ibrutinib pill, which I talked about on one of my other videos because I was part of the combination in terms of all of that. So to summarize, amazing drug, and it's new, right? Venetoclax has really only been authorized, even in the US, 2016, I heard. In the UK, 2020, and as part of the combination, it was really 2022. So this is brand new stuff. Very powerful drug, highly effective drug, and particularly good at hoovering out those tumors which come with CLL. Amazing drug. Yes, there's a couple of side effects you've got to be aware of, and I'll cover more of those on the next video. But the key point is you can live a full and an enjoyable and a glorious life with Venetoclax. And that concludes my video today. If you like the video, please remember to hit the thumbs up button. It does help on the algorithms. If you like the style of the video, please subscribe to the channel so you can hear and see more content as I upload it. Thanks again, and see you in the next one. I'd also like to express my sincere thanks and huge gratitude to John Gribben and to the team at the London Clinic, who were absolutely fantastic in helping me on this journey.